California voters in November will decide whether to require certain health centers to spend 90% of their money on patient services. Andrea Flores explains what would change under Proposition 44.
This November, California voters will consider Proposition 44, otherwise known as the Clinic Funding Accountability and Transparency Act. It's sponsored by SEIU United Healthcare Workers West.
We want to ensure that these community health clinics, which receive a large amount of taxpayer dollars, that they are spending the money on direct patient care and other mission-related services.
Prop 44 requires federally qualified health centers, or FQHCs, to spend 90% of their revenue on program services and report financial records. Community health clinics that don't meet that 90% would face penalties.
We already put patients first. Prop 44 is basically ridiculous. We're already doing our mission again at WellSpace Health is to achieve regional health through high-quality comprehensive care, and we mean it.
WellSpace Chief Health Officer Dr. Janine Barra says its network of nonprofit community health clinics, and many like it, are already stretched thin after funding changes under the One Big Beautiful bill.
At WellSpace Health, we are not for profit, and this means that we don't have shareholders, and the majority of our board are actually our patients, and all of our money goes back into providing those vital services. Those services such as nursing managers, patient advocates, community health workers, things that really make the difference to helping people get to the right place to get their care.
Under Prop 44, administrative costs, management, and other non-program expenses would be limited to no more than 10% of revenue. SEIU UHW West spokesperson Renee Saldana says this proposition is meant to put patients first and keep clinics accountable.
What we've seen is that there are certain clinic systems that spend less than 60% of their total funding on things that aren't patient care. What we're seeing is oftentimes some of these community clinics are spending money on non-essentials like art collections, fundraisers where they lose money. And I think a lot of people would be surprised to know that many of these CEOs or other executives at these community health clinics that receive federal funding make millions of dollars a year.
We asked Dr. Barra how much WellSpace currently spends on patient care.
Being not-for-profit, 100%. Everything is needed in order to get people to where they need. Meaning, like, the patient advocate helps to make sure that the person knows where to get their services. And this proposition even has the ability to cut janitorial services. Why should my patients not be able to go to a health center that is clean?
Andrea Flores, California Politics 360.
If approved, Prop 44 would allow California's Attorney General to define which expenses ultimately qualify here. Penalties could be refunded if centers start following the law within 5 years, and centers could face criminal charges for false reports on spending.